Well, if you have Hashimoto's and you're exhausted all the time, you're inflamed, you're gaining weight, you're anxious, or you're just stuck in brain fog, there's a good chance the real problem isn't just low thyroid levels. Hashimoto's is an autoimmune condition, and autoimmune diseases live inside an environment of chronic inflammation. Well, hey, I'm Dr. Hagmeyer, and today I'm going to break down how chronic inflammation fuels Hashimoto's disease, what symptoms it can create, and the key labs that I use to monitor and assess patients for inflammation, including the arachidonic acid to EPA ratio. I'll also explain a step-by-step approach of things in the bucket that you need to work on. So chronic inflammation is different than inflammation that you get when you sprain an ankle or you have the flu. That's acute inflammation. Short term, it's helpful and it resolves, but chronic inflammation, on the other hand, is low grade. It's persistent immune activation. And it can come from gut issues, and come from high blood sugar or blood sugar instability, and come from high and low cortisol levels, and come from toxin exposure, nutrient depletion, infections. And in patients who have Hashimoto's, they're often battling with different drivers of inflammation all at once. When inflammation becomes your baseline, your immune system is more likely to misfire. And that's the crossroad of where chronic inflammation and autoimmunity come together. Hashimoto's is an autoimmune disorder where the immune system produces antibodies that go on to attack thyroid tissue. Over time, that creates chronic inflammation and damages thyroid cells. And if this is an ongoing inflammatory state for the thyroid gland, that can also cause things like a goiter that many patients with thyroid disease go on to develop. Research also shows that inflammatory signaling molecules called cytokines play a major role in immune activation in Hashimoto's disease. So yes, thyroid hormones matter, but in many patients, it's the immune fire which is the bigger story. And if we don't address that inflammation, people often stay symptomatic, and even despite sometimes having normal TSH. So here's why this can get a little bit confusing, because if we look at the symptoms of chronic inflammation and we look at the symptoms of thyroid issues, they're often identical. So common inflammation symptoms are going to include things like crushing fatigue, especially after meals, brain fog, poor focus, low motivation, joint aches and muscle pain, stiffness, headaches, sinus problems, congestion, very reactive skin, feeling wired and tired at the same time, and then the slew of intestinal issues, food sensitivities, weight gain, puffy fluid retention. These again look almost identical to those symptoms that someone with thyroid issues have. So if all your doctor is doing is increasing or decreasing your thyroid medication, you still feel awful, it's time to start asking some different questions. Start asking, are we treating the hormone levels while ignoring the inflammatory drivers, right? The good news is inflammation leaves clues, and we can measure that with testing. So let's talk a little bit about the tests, starting with the basic ones, and then we'll move into more advanced markers like the arachidonic acid to EPA ratio. The first one is high sensitivity C-reactive protein. This is one of the best general screening tests for low-grade inflammation. Many cardiology risk models consider CRP levels greater than 2 meaningful, and risk-enhancing inflammatory signals, and greater than 3 often is considered high risk. But in functional medicine, I want to see these levels at 0. Now, CRP can spike with things like insulin resistance and metabolic syndrome and infection or injury. So again, the context of this matters. The next test is the ESR test, or the erythrocyte sedimentation rate. This is another marker of inflammation. And when inflammation occurs because of infection or autoimmune flare-ups, your body releases proteins like fibrinogen, and that causes red blood cells to clump together and they become very sticky. And when they stick together or clump, this is why ESR levels are being measured, right? They measure the inflammatory response when red blood cells stick together. Number 3 is ferritin, and this is an iron panel. Ferritin is an iron storage marker, but it also behaves like an inflammatory marker. When you have high ferritin levels, this indicates inflammation. This can drive fatigue and hair loss and poor thyroid function. Other markers that make me think about inflammation are metabolic markers that relate to blood sugar. Metabolic inflammation markers, because again, blood sugar instability is inflammatory. Here's where I often look at hemoglobin A1C levels, insulin, triglyceride to HDL levels. I look at liver enzymes. I look for fatty liver. So again, those are very important inflammatory markers. The last marker I want to briefly talk about is the arachidonic acid to EPA ratio. Again, omega-3 to omega-6 levels. This ratio is important because it gives insight into the balance between, again, omega-6s and omega-3 fats in your body. And that balance influences inflammatory signaling. Now, a high arachidonic acid to EPA ratio indicates that you're in a more pro-inflammatory state, while a lower ratio indicates more anti-inflammatory balance. The higher your arachidonic acid levels are, the higher the levels of prostaglandins and leukotrienes and thromboxanes. And these, again, have a circulating pro-inflammatory state in the body, more blood clotting, more smooth muscle constriction. So again, we want to aim for that lower arachidonic acid to EPA ratio. So as a functional medicine doctor, the reason I like looking at the arachidonic acid level and the arachidonic acid to EPA ratio and the omega-3 index is because it's not just, are you inflamed, right? It's more like, what is your body made of? Your cell membranes and the fats stored in them, which is arachidonic acid, changes how your immune system behaves. If testing shows you have chronic inflammation, the goal is to work through these buckets. That might look like this. It might mean remove the drivers, address gut overgrowth, food reactions, mold exposure, high cortisol levels, low cortisol levels, whatever is keeping your immune system activated. Number two is stabilize blood sugar and cortisol rhythm. You see, because blood sugar crashes and poor sleep can keep inflammation turned on, so you have to fix blood sugar. Number three is support digestion and bile flow, because elimination here matters. If your body can't move waste out because you're only having a bowel movement every other day, inflammation tends to recycle. Number four is rebuild nutrient reserves, vitamin D, selenium, zinc, magnesium, B12, iron levels. These again affect immune regulation. And number five, if arachidonic acid to EPA ratio is high, this is where dietary changes come in. Supplementing with 2 to 3 grams or more of omega-3 fatty acids can make an improvement in those inflammatory levels. So an important takeaway for this video is this, is that Hashimoto's is not just about replacing thyroid hormones. It's about calming the immune system activation and lowering that chronic inflammation so your body can recalibrate and become more stabilized. If you want help figuring out whether or not inflammation is a part of your bigger picture and which tests make sense for you, be sure to visit my website and schedule a 15-minute discovery call. See if we're a fit. And if you liked this video, subscribe to my channel and be sure to check out this next video that I recommend that you watch as well.